Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for urticaria or freckles. What is urticaria or freckles? Urticaria is a fungal, the name of the fungus is Tinea versicolor, infectious skin disease. It is also called freckles. Who attract urticaria? Everyone, irrespective of sex and age, may attract urticaria. Though the disease looks simple, yet it is infective, so general hygienic practices must be followed. Else, the chance of infection is high. What is the nature of urticaria? In many cases, the disease dies off spontaneously in a few days. Again, sometimes it reigns many days, especially if the constitution of the patient is defective or there is gross negligence to observe hygienic awareness. Nature of the disease in children and in adults are different. In children, it generally attracts the face, while neck, chest, back, hands are affected in adults. Who are predisposed to urticaria? Those who care a fig for their hygienic awareness, those who perspire much, those who live in wet, damp, hot places, those who wear unwashed dresses, those who have oily skin, those who have low immune power like patients of cancer, diabetes, rheumatoid arthritis, lupus, etc. What are signs and symptoms of urticaria? Urticaria looks like matted, slightly raised, scattered and circumscribed skin eruptions. They may look red, coppery, bright brown, whitish yellow, or skin may darken. They may each burn and feel rough to touch. The body hairs may assume the color of the skin around. Is urticaria curable completely? Urticaria does cure if treated in its initial phase. Even chronic urticaria is curable if physician's advice are followed carefully. The marks of urticaria take at least 6 to 7 months time to fade out. But don't worry, spots would also go. What is important to note is that there is every possibility of its returning back. It would be an altogether erroneous idea to think that if it is cured once after getting medicine, it won't return again. How can urticaria be prevented? Please observe the rules to keep the infectious disease at bay. The general principles. Bath twice a day and mop up skin with a dry towel. Do not use others' napkin, towel, clothing. Wear cotton garments during summer. Do not wear sweat-wet dresses without washing. Don't allow sweat to dry on your person. Wash regularly your own handkerchief, towel, pillow cover and bedsheet. Now, the remedies. Badiaga in urticaria. Affected area becomes sore. Even friction of dresses is hard to tolerate. Glands around armpits appear swollen. Skin is tender all over the body. Epismel in urticaria. Urticaria stricken area swollen rosy red. Burning and stinging pain. Heat and touch intolerable to skin. Troubles worse towards afternoon. Patients are awkward, drop articles often from hand actually. For bad effects of suppression of urticaria, Epis is a must. It is famous Dr. Jar made an inference out of his long experience in therapeutics that when there is suppression of urticaria and the bad effects are shown in various ways, then the only medicine which is very much efficacious is Epismel. Please remember this. Rastox in urticaria. Affected area red, swollen, itches violently. Worse at night, during rest, in rainy season. Better in dry, warm weather, during motion, application of heat from rubbing. Antipyrine in urticaria. Urticaria with furious itching. Eruption are dark, patchy. Eruption appears suddenly, disappear suddenly with feeling of coldness internally. Angioneurotic edema. It is some related to skin but not directly urticaria. This is the patient of angioneurotic edema. Look at this face. There is swelling. This is called angioneurotic edema. It is edema, but not ordinary edema. It is angioneuritic. That is, here the blood vessels and the nerves are affected. It is not ordinary edema where the water is accumulated in the tissue space. It is not so. Copaiva in urticaria. Freckles are seen over abdomen in circles with itching. Patients usually suffer from constipation and urinary problems. Chronic urticaria of children, small water-filled blisters. That is, along with urticaria, these eruptions are also there, small water-filled blisters. Antim crude in urticaria. What is urticaria? Attacks nipple which become red. That is, antim crude affects the nipple area of the ladies also, and the portion becomes red with much burning. Especially troubles get worse in warmth of bed. With this run abdominal complaints. With this means this urticaria along with abdominal complaints. Corn appear over skin from little pressure. It's a characteristic of antim crude. Antim crude is a very good medicine for corn. Patient often talk in rhymes or verses. Taciturn. That is, the patients are taciturn. They just keep shut up and they keep silent. Children whine, cry when touched or talked to or looked at. Nitram irritating urticaria. Itching urticaria, burn also. Much eruption over folds of joints like elbow, knee. Eruptions itch more after a strenuous job. Patient catch cold easily, sneezing, watering from eyes, tired and weak. Dulcamara in urticaria. Urticaria get worse in cold, wet weather. Affected part turn rosy red or coppery. Glands of various parts of the body swollen, hard. Eruptions are on face, chest, neck mostly. Urtica urens in urticaria. Patients suffer from uric acid disorder and pinworms. Urticaria returns at every particular period of the year. That is, say in some summer season, every year in summer season. Eruption on skin, little elevated red. That is, skin eruptions are little elevated and red. That itch and burn. If it is administered externally along with internally, troubles go faster. That is, one can use also it externally. This is mother tincture mixing with distilled water over the surface. It will go faster. Arsenic alb in urticaria. Skin disease returns alternately with internal disease. Internal disease and urticaria alternates. One goes, say, when the urticaria is there is no internal disease. When it is gone, the liver is affected. Again, the liver is okay, then skin is affected. Due to eruption, skin turns whitish or blackish. Skin ugly, dry, burn severely. Patients are fastidious. These are the general symptoms of arsenic. Underlying symptoms are mostly general symptoms. Find faults always, hopeless about disease, fear of death. Children are whimsical, like to be carried always, move from mother to father, from father to any other. Do not find ease with anybody. With this, the video ends. Thanks for listening and viewing. If you got any trouble, please write down in the comment section. I will respond.